One way I look after my own mental health is with animals. We have lots of cats on campus, and I also look after quite a lot of dogs where I live. We have a sterilization and vaccination campaign, and we know that animals help us to feel better, they help us to bond, they reduce depression and anxiety, and they make us just generally feel happier. So I'm really lucky at the university to have cats. Another way I look after my mental health is by cycling. But I cycle with purpose. So sometimes I get a little bit anxious. We all suffer with various degrees of anxiety, depression, whatever. So what I do is I tie food on the handles of my bike and I go and just cycle and feed the stray dogs in my area. And I look after them and I treat them when I need to. So I think one of the most important things is recognizing what makes your mental health better, recognizing what's wrong with you, and then trying to find ways which are specific to you. So not just, a therapist can tell you to do X, Y, and Z, but it might not necessarily work for you. So in terms of organizations, we know empirically or from research that people who are happier tend to perform better in the workplace. So it's not just that absenteeism levels are lower, but also presenteeism levels are higher. So that means that people are more present in the workplace. We know that they're happier in teams, and we know that there's lower employee turnover. Probably a big question is, who is responsible for employees' mental health? So should it be the individual or should it be the workplace? So somebody in a workplace might say, well, it's not my business if my employees are happy or not. That's their personal life. And they come to work, they get paid, and it's not my responsibility. So this concept of responsibility to your employees has been something that's been coming up more and more because of the pandemic, because of what we've been seeing all around the world happening, because of social activism. What can organizations do to make their employees happy? Me personally, what I believe is understanding who your employee is. So if you develop blanket programs or blanket strategies or initiatives, it might not actually be useful to everyone. So you might be, for example, paying your employee X amount, and that might actually not be making them happy. So what might make them happy is perhaps working from home a little bit more, perhaps a promotion but without a pay increase, perhaps more flexibility, perhaps training other employees, maybe some responsibility. So unless you get to know your employees and their personality, you won't really be able to adapt or tailor different ways to actually make them happy. All right, so I've seen a bunch of initiatives across organizations. I've seen things like swings in the middle of corridors, yoga rooms, fitness plans, childcare plans. So these are all great initiatives. But again, unless you understand your employees, you might actually be wasting a resource. You might actually be injecting money into something that's perhaps just vogue. It's all the fashion to do something, provide maybe a therapy room, a meditation room. But what you can do, and we know that this is a fact, we know that employees who are given a say at work, so they feel that they're actually part of the organization's strategy, they're part of the organization's workforce, they can actually see that they've made a difference. So if you're asking people to come to a bunch of meetings and they can't actually see where they've added value, that can actually make them feel demotivated. So show employees where they add value, and then really personalize things. Other things definitely work. So we know in many organizations, things like childcare, things like training, promotion pathways as well. So not just giving them an unrealistic promotion, but actually giving them a pathway to where are you going to get in X amount of time. Mental health is something that we still don't talk enough about, and it still unfortunately carries a stigma with it. So somebody saying that they feel anxious or depressed is still something that people feel a little bit awkward and maybe a little bit, what do I do? But I have heard people starting to say that they're overwhelmed or they're burnt out. So we know that burnout is actually a diagnosable condition now, and it's okay to be burnt out. What I've actually started to hear recently, and this is becoming a global issue, is this aspect of loneliness. So even when somebody says to you, I feel lonely, that somehow is still carrying this stigma, more so even than anxiety and depression, because we're getting a little bit more familiar with anxiety and depression, but even not personality disorders. And this stigma really, in my personal view, one way of really breaking it down is for everybody to say, I feel a little bit anxious today, I feel a little bit depressed. And I really believe this has to come from the top, has to come from leaders. And it's not leaders saying, I'm depressed, I'm anxious, but leaders creating a culture where it's okay not to feel okay. And if we make our employees, or we provide a culture where employees feel like it's okay to have this conversation with their manager and say, I just don't feel okay today, then that helps a lot and it reduces the stigma.